Understand that the following information will be gathered and utilized for educational purposes by an Indiana Wesleyan University student. I give my permission for this information gathering and physical assessment to be filmed and posted on Blackboard for access by faculty and students at Indiana Wesleyan University. The video will be deleted by the student as soon as it has been reviewed and graded. I further acknowledge that this is for educational purposes only, and the information is not meant to be diagnostic. Therefore, Indiana Wesleyan University, the faculty and staff, as well as the student, are not considered liable.
Hello,
Hello.
I'm Maureen. I'm going to be your nurse today. How are you?
Good. How are you?
I'm good, thanks. Except I'm at work.
Yeah.
Nice.
And I'm here.
Real quick, just to make sure I have the right chart with me, can you tell me your name and date of birth?
Dina Regenworth, 3173.
Perfect, perfect. So what brings you in today?
Well, it's been about 3 weeks that I started to notice, I started to become constipated, and within the last 2 weeks I'm fully constipated, and I'm noticing some blood in my stool.
Oh, okay. So when did this start? 3 weeks ago, or you noticed something before that?
Well, about 3 weeks ago, and then in the meantime I've only really had really small amounts of stool, like bunny balls, really nothing major, and so it's causing a lot of distress in my stomach area, my abdomen.
And can you pinpoint anything that seems to aggravate it?
No, I've just been constipated for the last 3 weeks.
What about anything that could alleviate it? Like, have you tried more fiber, more water?
I did try a fleet enema, and
Okay,
that gives
fleet
me a
enema.
little bit of relief instantly, but then it goes right back to the constipation.
Okay. Did you have a lot of pain and cramping with the fleet enema?
No, not at all. I have pain and cramping without it, but not from the fleet enema.
Okay. Well, prior to this, what were your bowel habits like?
I would go routinely, maybe once a day in the afternoon. It would be a normal, nothing loose but soft.
Okay, so no pain really?
No.
Have you noticed any other changes in your life lately that you think might be attributed to this?
No, not at all.
Does, prior when you were having these bowel movements regularly, did they hurt at all?
No, not at all.
Oh, okay, perfect. Well, let's talk about the rest of you. Do you have any other medical history I should know about?
I do not. Well, I had some thyroid issues, and so I am on some medication for my thyroid.
And that's under control right now?
Yes,
You're seeing an
everything's under
endocrinologist?
Yes,
And have you mentioned the bowel issue to them at all?
I did not.
Okay. We'll look into that because,
Okay.
you know, it could be something related to the medication that you're on.
Okay.
What medications are you taking?
Levothyroxine
Typical. What dose?
at 0.150 milligrams.
Okay, perfect. Overall, how do you feel your health is?
I'm in good health.
Otherwise, no complaints of anything?
No. Mm-mm.
Okay. Are there any aspects of your health or the family history of health, like maybe your mom has diabetes or your dad has blood pressure or something that either you're worried about or that stresses you out or anything like that?
My dad is diabetic and he does have high blood pressure, but I'm not terribly worried about it.
Because do you feel like it's more lifestyle, or do you feel like it would be something genetic that you might be thinking about?
I know it's genetic. However, I'm not concerned about it. I don't have any symptoms of diabetes or high blood pressure or cholesterol.
You look as if you probably lead a little bit of a better lifestyle, very
Yes.
healthy and exercising. So when you have stress, how do you deal with it? Typically?
Exercise.
Oh, you dive into exercise?
Exercise, music,
Perfect.
yeah. Eat.
Well, that's good, as long as you're eating the right things, right? What kind of support system do you have?
I have great friends and family, so they're always there for me.
Well, that's good then. Where do you live right now? What are your living arrangements like? Do you
It's just
live
my
with
son and I.
family?
I'm a single parent.
Mhm.
Just my son and I.
And you feel stable in that situation?
Very stable.
Is there ever a time where you feel unsafe, either by, you know, anybody who's in your actual dwelling or by the neighborhood or anything like that?
No, not at all. It's a
Oh.
very comfortable area.
All right. And do you uphold any spiritual beliefs or religious practices that you would like kept up concerning your health?
No, I mean, we are Jewish and we do the temple and synagogue only on high holidays, but I don't think anything is contributing.
So it wouldn't help you at all if I were to contact anybody
No. Mm-mm.
about anything?
No.
Okay, perfect. And what do you do?
I am a school teacher. I'm an educator.
Oh, very nice.
Yes.
Um,
So that could be a little bit stressful,
it could definitely.
which is why I love to run.
Yeah, but definitely. Being a teacher, I couldn't do it.
Yeah.
You know, some people say they couldn't be a nurse. I couldn't be a teacher.
Yeah, I couldn't be a nurse.
Do you feel that either your profession, your financial situation from the profession, your insurance situation from your profession or anything like that impacts the choices you make in your health?
No, I have pretty good health insurance,
Okay.
so I don't think it impacts anything as of yet.
Okay. Well, so far I feel as if I have a very good picture as
Okay.
to what exactly we have going on. But I would like to do a physical assessment,
Okay.
kind of see if I notice anything that appears abnormal to me.
Okay,
So would that be okay with you?
absolutely.
Okay. The first thing I'd like to do is look inside your mouth and throat.
Okay.
Typically, if I were to see anything that were out of the ordinary, it might make me think that, maybe you are refraining from food or from liquids because of, anything that might not be right.
Okay.
And maybe you don't even realize it.
Okay.
So can you open up your mouth for me? Perfect. Say ah. Okay, right now I'm assessing, the condition of the teeth, looking for any sores,
Okay.
looking for any irritation everything looks pretty good. I'm assessing your tonsils. I see that you still have them. So
Okay.
obviously you haven't had too many problems there.
No.
Any pain in your throat at all?
No, not at all.
Real quick, can you lift up your tongue for me?
Oh.
Perfect. Perfect. Okay, good. I just want to make sure that we don't have any tumors or lesions. I'm just checking to see, again, if your throat is red. No, everything looks good. Okay, so
Okay.
you don't feel as if you have any problems with swallowing, chewing, eating, anything?
No.
Perfect.
Mm-mm.
Okay, well then I would like to assess your abdomen. Would you mind laying down?
Sure.
Okay.
Just lay right here?
Please.
Can I put my head on the pillow?
Please do.
Okay.
So
Is this okay? Just like this? Okay.
Perfect. So normally the first thing I would do is assess your abdomen, obviously without any clothes on. I would be looking for anything anything abnormal.
Okay.
So I would be looking for maybe a herniated umbilicus, any drainage from your umbilicus. I'd be looking for any pulsations, any striae, any abnormal markings. Looking at your abdomen overall, it appears completely normal.
Okay.
Okay. Do you have any pain or tenderness at all?
No, not at all.
Perfect. Do you mind if I
No.
palpate? So I would be palpating all over your stomach using 2 hands, pushing down, not too hard. What I'd be watching for mainly is 1, do I feel anything abnormal? But 2, do you jump or are you guarded in any way?
Okay.
Maybe you don't even realize that you did have some sort of abdominal pain.
Right.
So another thing I would like to do is actually listen to your bowel sounds. Do you
Okay.
mind if I listen to your belly?
No.
So using my stethoscope, I would listen to the bowel sounds in all 4 quadrants. Typically we start in the left lower quadrant because the way your bowels go, it goes from your left lower quadrant up to the left upper, over to the right upper, and down.
Okay.
So if you don't have bowel sounds here, you're typically not going to have any bowel after that. And in each quadrant, I would listen for 5 minutes. Besides for listening for that, I would also be listening to your abdominal arteries. You have 5 of them. The aortic artery is about 2 finger breadths above your belly button. You have 2 renal arteries that are 2 finger breadths below and out 2 inches on either side. And about 2 inches below that, you have your iliac arteries. By listening to those with my stethoscope, I could listen for any abnormal swooshing, maybe a potential. I would be listening for any abnormal swooshing, which might indicate to me that there's a blockage in the blood flow. But from what I'm hearing, everything sounds completely normal.
Okay.
So let me help you sit up. Okay. So just judging from the little bit of a physical assessment I've done here, I really honestly think you just have an issue with constipation. I'm going to go ahead and go out and tell the doctor everything that I have found.
Okay.
He's most likely going to recommend more fluids, more fiber, a supplement called Miralax, totally safe to use every single day.
Okay.
Okay?
Thank you.
But let him come in here and do his assessment.
Perfect. Thank you
Okay?
so much.
I hope he doesn't ask you all the same questions.
I hope so too.
But he might.
But no, thank you very much.
You're welcome. So by asking Dina about her financial situation, her living arrangements, her job, her spiritual beliefs, I'm able to assess whether or not she has stress coping mechanisms, whether or not her level of education was high enough for her to be able to balance all the different aspects of life that she has coming at her. This helps me assess what level of Erickson stages she has passed, where she is psychologically, whether or not this is more stress-induced. Is it typically something that is being brought on by the environment that she's living in? So I was able to assess all 5 of our realms as well as the physical assessment in there. Thank you very much.
Thank you.
Bye.
Bye.